Okay, hi guys. Welcome to Many Faces, One Vision. I am super excited today because as I begin this series, I'm excited to speak with a friend and also a colleague about the value of community health worker. So I would like to introduce you to Tammie Peterson. She has been very instrumental in helping me to see the value of community health workers, but also in just teaching me the role, and also she has a wealth of experience. She works in the senior community, and she's also going through a career pivot. But I'll let her explain that to you. So, Tammie, thank you so much for agreeing to do this with me. I've been wanting to have this conversation with you for so long. So, thank you so much.
You're welcome. Thank you
So,
for inviting me.
Well, thank you. Because when I look over, like, as far as my career as a community health worker, and it's something I knew nothing about until I formed my nonprofit, the Ruby A. Neeson Diabetes Awareness Foundation. And we met a couple years ago. I believe it was at an event. I didn't meet you at the event, but we met over the phone. I was having an event for World Heart Day at Greenbrier Mall, and you were interested and maybe being a vendor. So I got to know a little bit more about what you do as a community health worker. And at that time, you were working in the senior community in housing. So when I think of a community health worker, and that's one of the reasons why I like the role, is because we connect people to resources. And other things, I started actually policy researching and advocating. So, but in addition to that, the advocacy work and the policy research, we also connect people to resources. And at the time, housing is one of the most important. I mean, housing is so important. You can't take care of yourself if you are stressed and worried about housing. So, how did you just share a little bit about your background as a community health worker and how your career came to be as a community health worker?
Well, I started in 2016 with United Healthcare. Um, the role was actually called a STARS member navigator, but it was
Mm-hmm.
doing the work of a community health worker. So um, we were given a list of members to call and engage with them on the phone initially in terms of uh, gap closures as it relates to maybe screenings that they haven't made appointments for, um, trying to assist them with any resources that they may need. So things of that nature. And then I would also go out to go out and do home visits and meet with them in their home and sit with them and find out what's going on. It was kind of like putting eyes on them
Yeah.
before, or in addition to a nurse coming out
Mm-hmm.
to, whatever was needed with them, clinical wise.
Mm-hmm.
I enjoyed the job, because, I enjoy helping people who have, um, who need help, who need assistance,
Mm-hmm.
people who are misfortunate. These people, the people I mainly worked with at the time, they were seniors.
Yeah.
Well, not all seniors are the same in terms of health
Mm-hmm.
and, and aging well. So it has always been a passion of mine, one of my passions in terms of, health advocacy and then helping the elderly population have their best life. So
Right.
after United
Yeah.
Healthcare, hmm? Yes.
No,
So
I was
after
saying, yeah,
United Health,
the singers deserve their best life. Yeah.
so after United Healthcare ended after 3 years, I was really sad to go because I really loved United Healthcare and just my job and what I did in general.
Mhm.
But so layoffs happen, so you go to another company, and I essentially did the same thing with the exception of not going out in the field, and that's because at that time COVID had now happened around the world. So I just mainly made phone calls to people and people who weren't seniors either now at the time. So it and it was kind of difficult sometimes to
Mhm.
engage with them on the phone opposed to face to face.
Yeah.
That's because in some instances they can't hear you well,
Mhm.
or they can't write things down, and I can't give them certain things because a lot of times they just either want you to write it down or have certain things on paper. And so that was kind of that was challenging.
Yeah. So and we're going to get into some of the other challenges of being a community health worker. So Tammy, you mentioned that you would fill in gaps. Can you talk a little bit about some of the gaps that you would have to fill in for someone? Because you also mentioned as a community health worker, we're there to really um, help the clinical side. So what are some of the gaps? Because in the diabetes community, when one of our patients, oh, I call them program participants, let's say they are recently diagnosed with diabetes or they have disabling diabetes, and I think one of those gaps could be either they don't have, a car to get back and forth to their doctor's appointment, or even support. I feel could be a gap if they live alone and they don't have support. So can you explain what are some of those gaps that you mentioned that you would have to fill for your patients?
Okay. Well, upon doing what's called a HRA, which stands for Health Risk Assessment, that could
Mm-hmm.
be for your annual wellness exam, getting your glucose checked, getting your eyes checked, um, if you had any dental issues. Trying to see what some of the other ones.
So those gaps were because at that time, initially, when you were with United Health, well, with that managed care plan company, you were filling in gaps for them.
When you say, well, okay, yes, because by working for a health insurance company, they know when you have not had certain screenings done.
Mm-hmm.
And so there's a certain timeline for doing certain screenings, most of the times every 12 months. And depending on a person's health, it could be every 6 months.
Mm-hmm. Yeah. So the value of, because many people hire, and I want people to know this, many people now or different entities, they hire community health workers. So you have some managed care plans or insurance companies. You have even maybe some corporate places may hire a community health worker. So Tammy, you're speaking about an insurance company, and also that helps with their bottom line because hopefully their goal is for their patient to be healthy. And you also mentioned COVID. Now, COVID is kind of a touchy topic because COVID, there were so many sad moments of COVID. But in order for us as an organization to pivot, I think that's when the community health workers kind of, I don't want to say they shined the most, but that's when I saw the value a lot with the community health workers, and because they were also frontline workers that were connecting, like you said, filling gaps and connecting people to resources.
Hmm. Well, well, a lot of people were not going to the doctor's office, um,
Mm-hmm.
especially if it wasn't chronic or if it wasn't emergency. So certain things that you would just kind of just normally go for, just to go to ensure you're doing well, you weren't going because they weren't making you weren't going. So now obviously CHWs weren't replacing anybody that was clinical.
No,
Um,
they were not. But the reason why I say seek community health, because I'm always going to kind of go hard for community health workers, because I think during COVID, what I would see, and not to cut you off, I'm sorry, what I would see, because as far as the value of a community health worker and those gaps, if you were in an underserved community during COVID, let's say you were in a rural area, you didn't have access to internet and things like that, then the community health workers, that's when they were able to step up to help get those, not those clinical services, but those non-clinical things. They were able to address that. And I always talk about that in the diabetes community, because when we talk about diabetes, and let's say A1C never shows your environment. It just says that you have not been taking that great care of yourself, but it doesn't show your environment. And what I mean by that is you don't see the things that you lack, where you cannot, manage your health as you should. You may have some things that you may not have access to, some things, access to better foods. You may not have access to the internet. So that's what I mean. We were able to address some of those gaps or some of those things that didn't have anything to do with clinical.
Well, when it comes to gap in care,
Mm-hmm.
that's usually specifically for and connected to things that are of clinical nature. Going back to the insurance company. So in order to ensure that a person that is insured,
Mm-hmm.
you want to make sure that they are staying on top of things that should be done yearly.
Okay.
Exam,
Yeah. Mm-hmm.
your eyes, your teeth, and then there's other separate things, other additional separate things depending on that individual's health. And so that phrase gap in care, it doesn't really, it doesn't relate to not eating or not having any food. It's mainly associated with screenings.
Yeah, and so what I'm thinking about, you're right. So I guess what I'm thinking about is not gap in care, which is important. So I'm so happy you're highlighting that. I'm thinking about some of the social detriments of health, some of the
Oh,
things that
okay.
they don't have. Yeah. Because there's so many detriments to health that will prevent, it will hinder, a patient from getting the care. So when it comes to diabetes, because diabetes is one of the more common chronic diseases in not just Georgia, it's a global issue. But when it comes to diabetes, how important, what is the value of community health workers for those who are living with diabetes, or even those who want to prevent diabetes?
Well, okay, SODOH, social determinants of health. So
Mm-hmm.
that came about when it was realized that even if you don't have a gap in care, in order to remain healthy, you
Mm-hmm.
have to have other things to sustain, like eating and eating healthy, right? So if you don't have food or you don't have enough food due to financial circumstances, then that's where the knowledge about food banks
Mm-hmm.
come in. Um, it could also be situations with transportation. You may have even, and so a lot of insurance companies, they offer a certain allotment of transportation, but once that allotment is exhausted, then it's up to you as the insured to get to your doctor's appointments.
Mm-hmm.
And so
Or
then
those that don't have, I'm sorry, those that don't have any insurance. Yeah.
yes, you have to try to find some type of somebody or something to help you get from point A to B that's associated with your health. There are some programs out there,
Mm-hmm.
and one site that is very good, it's called findhelp.org. And you
Findhelp.org.
put in, mhm, and you put in the type of help that you're looking for and your zip code, and um, depending on where you live, you'll get like an abundance of different results of things. Um, so, but as far as the transportation, um, that's most likely going to be something that's private. So obviously, when people hear that, it's going to be a cost, right? So um, I'm trying to see. Let's see some other social determinants of health. Utilities.
Yeah.
Okay, so let's just start. Let's start with that. So, um, nothing in your household is gonna matter if you don't have any electricity.
Yes, especially if you're
Because that,
diabetic, because or housing, like
yes,
how we met during the housing. Housing is a
hmm,
social detriment of health. And how can you,
yes,
if you're diabetic, especially if you are required to take insulin therapy, you need a
hmm,
place to live, you need a refrigerator to put your medication. So yeah, you're
hmm,
right.
yeah. So yeah, housing is a factor, but even if you are okay with your housing, but then you can't pay those utility bills. See, people don't. There's programs out there. It may be difficult to find, get on the list, get the appointment. So those are other hurdles that you have to go through once you find out about the program. And one that most people know, LIHEAP, low income heating assistance program, but it also is a cooling program. It works for your air conditioning as well. And so, um, because if you're not treated from the whole
Yeah.
perspective of could everything that's associated with you, it makes no sense to have this surgery, and then when you're in the recovery process of going home, then you have a decline because you have no heat or you have no air condition.
Mhm.
Things are cut off, or you don't have food, or you don't have the proper food. So then you're just going right back downhill again, and then right back into the hospital.
Yeah.
So that's where the importance of
Mhm.
CHWs come into play.
Yeah.
All right.
Mhm.
Um, and people need to realize that and see that. So CHW really is a social worker,
Mhm.
honestly. I don't, I know the social worker has a license tied to it, and the CHWs don't, but it's the same work,
Yeah.
same same thing.
Yeah, and we
But
hear that. We hear that a lot. Are you a social worker? Like, no, I'm not a social worker. We're community health workers. So, how do you feel? You said that, and we do feel that community health workers are like social workers, but social workers are social workers. So, how do you feel that, or how can that be? Well, do you see that as a barrier? By definition, we're not social workers.
I don't know if it's a barrier. I'm just confused because it's the same type of work. That's the thing. It's the same situation. I guess I need to find out what's the license portion for,
Yeah, I mean
because
that's the difference. The
yeah.
social worker is licensed, but let's because I don't that's one debate. We hear that all the time. Social worker, why you're not a social worker anyway? But I do want to talk about now. You have another great thing I love about being a community health worker because I love being a patient advocate. So you had an opportunity to travel to DC before to advocate on a bill. How important do you feel that it is for community health workers to help the community by sharing stories and raising helping them to expand their voice? How was that? How was it when you went to DC? And how important is it for community health workers to engage in advocacy?
I think it I think it's highly important, and it was such an extraordinary experience and amazing to be in that environment.
Mhm.
Never knew such a thing existed. And so to go in those different rooms and collaborate with people who around me who, you know, sadly was fighting for their
Yeah,
lives. And
yeah,
it was very heartwarming. It was very touching,
mhm.
um, to connect with those people. And I know somebody that's close to me that was that was on dialysis and having kidney issues. He has now since received a new lease on life of getting a
Oh,
new
great.
kidney.
Mhm.
But that was another reason why I wanted to go, because I had someone in my circle that was having kidney issues. So to be an advocate for that, you know, I really felt, wow, this is really important to do.
Yeah.
And a lot of times people may feel like because they're not experiencing a certain thing or not going through something, that they can't relate. They can't relate. Or they were asking me, well, do you have kidney issues or kidney problems or whatever? I'm like, no, I don't have to be unhealthy to know to empathize with someone
Mm-hmm.
when they're going through a health situation. All right. So the H and CHW stands for health, and then I collaborate with people in the community. So just going up to Washington D.C., it left a lasting, impactful, a positive impact on me. It was just very I really loved it, and I thank you so much for that, because I also made some friends
Yeah.
out of it,
Mm-hmm.
and I met with one of the women last week. We went and had
Yes,
lunch,
me
and the
too.
other
Mm-hmm.
she lives in another state. So I'm always going to go hard for somebody when it comes for health,
Yeah.
um, and just doing right
Yeah.
by them.
And
We shouldn't have to fight. We shouldn't have to fight for our health.
I agree.
We shouldn't have to live.
I agree.
It is a God given right.
That's right. And I think that when you have, and I'm happy you were able to also travel to DC, and we meet with people here locally. So, and it's sad, like you said, it's a right, but it's sad that sometimes we elect people, or a majority of people elect someone that feels it's a privilege and it's not a human right.
Everybody deserves to live.
Right. And I know you're natural. And that's, I always call Tammie our healthy aging guru. So, because I've traveled with Tammie, and I would see all of her nice skincare and how she eats. She's very meticulous. Like, we go to lunch, she's going to always get her green tea. She's always going to make sure the calories right. It's no fat. And I love it. I'm not going to tell your age, but you guys would not believe it. She takes really good care of herself. So I call her our healthy aging guru. So I know that you want people to live, and you want people to age healthy. You get on our men about about them and not aging healthy. So we have to prioritize healthy aging. So I
Hmm.
love that about you. But let's go kind of detour back to legislative and legislation. How do you feel in today's climate? And we don't bash politicians, because I appreciate working with everyone who cares about the well-being of Georgia, who wants Georgia to be healthy. But how do you feel about today's climate, and how community health workers structure in today's climate with so many programs
Well,
getting cut?
to start off, my answer to start my answer off, that's going to depend on the state that you're in.
Mm-hmm.
To say that like that, because that's the honest way for me to form my answer.
Okay.
Um, because as you mentioned, when a lot of things get cut, that's what makes the job more challenging and stressful and difficult.
Mm-hmm.
Because if you think about the word community, and certain things are no longer in the community
Mm-hmm.
providing services, what are you going to do? Where's the help going? Where's the help and assistance going to come from somebody who has very low income or no income?
Yeah.
So we can't feel that people should be unhealthy or die because they have no income or because they have very low income. So it just depends on what state you're in, for certain things. I just got to be more specific, because if you're in a state that doesn't have the expansion of Medicaid, well, that makes it difficult.
Right.
Okay, so
Mhm.
um, because if we're talking, because the majority of time, community health workers are helping low income
That's
people,
right.
people
Mhm.
who do not have insurance, people who are underinsured. So it just becomes you just spinning your wheels, making phone calls, and you're not getting anywhere because you're tired of this entity no longer exists. This entity is not helping financially, or you have to fit in this category. Are you this? Are you that? You know,
Yeah.
to going through all that alone is enough to bring your health down.
Right.
And then talk about your mental health. Let's just put that in there. So that makes the job harder, and is it just depends on where you live when you're doing the job. That's the bottom line.
And we've been having conversations about Medicaid expansion in Georgia for so long,
Yeah.
for a long time. Right. So, and another thing, and this initiative is led by, I believe, Georgia Watch, trying to get community health workers certified. Do you feel that our legislation, do you feel they understand the value of community health workers?
No, and I say that because of the salaries that they want to attach to it.
Mm-hmm.
If the job requires um, a lot of work into it, in terms of like researching
Right.
and getting people connected and spending quality time with them, and then them calling you back and forth. So it's like, on one hand, a certain portion or percentage may see it of value, but then the salary is down here, and it's not up there where the value should be. So it just depends on, I don't know. I mean, basically, I feel like, they want it. I mean, it's like we're
It's a
wanted.
need. Yeah. Mm-hmm.
Need, but our salary is not where it should be.
Okay, so and let's go. We can talk about some of the challenges as a community health worker, because I know for the past, I want to say for the past 4 or 5 years, and it may have
Hmm.
been a year before COVID. I'm not sure, but we have been trying to get a bill passed so community health workers, which it would make the pay a little bit better. I don't have the bill information before me. If you do, you can speak on it. But what if you don't? That's fine. But what are some of the other challenges to being a community health worker?
Well, I guess depends on where that person lives that you're trying to help. Because if they live in a rural area, then that's just going to be more challenging for them and you.
Okay.
Um, you don't have as many options of help in rural areas
Hmm.
in relation to metro areas or the city. So at best, like I said, depending on where they live in a rural area, you may have two, maybe three, in some cases just one, and that's it. So, and then if that person is not able bodied or doesn't have transportation, and see, that's another thing. So a lot of situations, a lot of companies that may provide transportation, they may not go way out there, or way, and they just don't. So then you're just kind of left with, having to apologize, because the the help that they need is just too far away, or they're too far away from where the help is. So that's always been a challenging factor.
Yeah, because it makes you believe that your address, it determines your level of care or level of resources.
Hmm. Yes, it does. I mean, I guess in some ways, depending on your family circle and your support and what's going on with you health wise, your living situation will dictate that. So in some cases, some people may have to make the decision to come closer into town if they have health conditions in which they need to see certain specialists frequently. Um, but yeah, so that's really all I can say in terms
Mhm.
of um, people who live further outside of Atlanta.
Yeah. So, and we're gonna get ready to wrap up. I did mention that Tammie is our healthy aging guru, and we have had conversations about pivoting in careers. And I do want you to mention, to give some tips. I know it doesn't necessarily have anything to do with being a community health worker, but I think our social health is important. Our career health, that's important also. So I just wanted you to kind of give some tips. But before we go into that, that will wrap up our conversation. Tammie, as a community health worker, experiencing some of the challenges you have experienced in this industry, and how long have you been in this field?
In terms of community health
Yes,
worker,
even when you like
um,
a navigator, like the health industry, like the community health industry.
oh, wow. Ooh, it was 20 years, but 10 years for CHW.
Okay, so we'll say 20 years, but because it's still kind of related, what would you like for people to know? I mean, the community to know about the value of community health work, and also legislation or our legislators. What would you like for them to know about the value of community health worker and how they may be able to make the role better?
Sometimes to see beyond money, see the importance and beauty of life. It is very difficult to survive
Hmm.
nowadays and not be healthy. Okay, so now let's add someone who is not healthy and having health challenges. I just wish sometimes that there wouldn't be such a heavy emphasis all the time on metrics and numbers. Now, don't get me wrong, I do understand that, finances do play a role or a part in having things.
Hmm.
But at the end of the day, one thing that I learned and I will always remember when I first became a health insurance navigator, as the Affordable Care Act came into existence, is dignity.
Hmm.
What I mean by that is people who never had insurance before, they were always used to going to some type of organization or clinic or mobile this or mobile that. And those are great to have, but there's nothing that will ever replace the happiness when a person can hold in their hand an insurance card.
Yeah. Yeah.
Feel like, wow, these are, grown individuals that I helped, and after they saw that they were improved, and this is your insurance plan, and me educating them about their insurance and letting them know they're going to get a card, with the name on it with information about their plan, and they can go to certain doctors, they can go to doctors' offices, not a free clinic
Hmm.
or mobile van or whatever. And I'll
Yeah.
never forget when a woman told me that she felt so good to um, have insurance.
Mhm. Yeah. Insurance is important. Coordinated care is important.
Yes.
Community health workers are important. And I wanted to also ask you, what do you think? We're talking about some of the barriers, but in your personal opinion, what do you think is like one of the biggest barriers to care?
Not having access to it.
Okay.
Not having access to it. Meaning you can't be seen because you don't have insurance. And then you're afraid to go somewhere because you don't want to get a bill because you know you're not going to be able to pay it.
Mm-hmm. Yeah, I agree. I agree. So I again, Tammie, wanted to thank you because we have this conversation quite often about community health workers um and their value. So, and because again you're a healthy aging guru, I do want you to share some tips on, yeah, healthy aging and pivoting, because there are a lot of, we know, we work with seniors. We know some seniors are even still working in the workforce. We have some people that are planning to retire. And so what is some advice that you can offer for pivoting
Mm.
in career, because that's a part of healthy aging and it's a part of our health.
I would say go where your heart leads you. Looking, we all have some type of skill set that we probably didn't even know we had, and it just needed to be fostered in some type of way. We only get one life,
Hmm.
one time to be on this earth. And as we age and get to a certain phase in our life, a lot of times people are afraid to do certain things, to change. We get in this, that they have this mindset, because I'm this age now, I can only do this or I can't do that, or whatever. Um, Whatever you feel is in your heart is the right time
Hmm.
to do something. Take a chance, take that risk. And I'm not saying do anything that's just totally like, you know, crazy, but there's going to be a certain times in our life where maybe, God may be leading you through certain actions that's been happening to make a change. And a lot of times we, like I said, we may be afraid to do that or feel that we don't know anything else but what we've been doing in a certain 9 to 5.
Yeah. Hmm.
But if I could offer one thing to always remember, never trade peace for a paycheck.
That's
Now, I
right.
know in these times what we're going
Mhm.
through right now, I know that is difficult.
Yeah.
I I do realize that, but you never want to get to a point in your life and be a certain age and then regret what you didn't do, or look back, I should have did this, I should have done that. And we always like to wait for the perfect time for certain things, right?
Yeah.
There is a time and a place for things. But if you know that you've been doing something for a long period of time,
Hmm.
it's okay to say, you know what, I want to change now. I want to do X, Y, and Z. I also have, it's more than one passions out there. Okay,
Hmm.
so people need to, remember that. So if you have a passion in something else, go for it. Change. There's plenty of people who probably started off maybe being a nurse or a doctor, and they're probably a pilot now, or vice versa. So that's what I would say to people. Never be afraid to take a chance, take a risk. Um, it's all in, how you do it. And so, in reference to me, you know, I was also very passionate about something else, and I was always doing it on the side, part time.
Mhm.
And I always felt like, okay, I love doing that. And just to share it, I'm a photographer as well.
Mhm.
So I love photography. I actually went to college for broadcasting and journalism.
Mhm.
But guess what? I didn't. When I graduated, I didn't go that direction. I actually got a job with an airline,
Yeah.
and I was in the airline industry for 8 years. I wasn't a flight attendant. I was a person that you see when you first come in there at the ticket counter at the gate.
Mhm. Mhm.
But I loved it. I got to travel the world. I got to go to 10 different countries. I got to learn about different cultures, not just people coming up to me checking in, but the employees. And
Mhm.
in the break room, I'm eating my American food lunch, and then I'm sitting next to people, and they're eating food from their cultures and things, and just learning things.
Yeah.
Um, anyway, so I say all that to say, even though I have 20 years of non-clinical healthcare, and healthcare will always be my passion.
Yeah. This is
To
in you.
Yeah,
Yeah.
it is. It is. But now I'm in a different phase of my life and doing what I wanted to do from
Yeah.
just I don't want to say I was a little girl when I picked up a camera or whatever,
Mhm.
but um, I love I love photography. I have elevated from that to
Yeah.
the other things that are in media
Yeah.
and production. So here we are. I am healthcare, media, entertainment, in person. I don't know. Maybe one day those can merge together. I don't know.
Yeah, and they can. And so if you're watching this, you may see Tammie on the TV screen or in a movie. I've caught her in a couple of them. But I want to tell the people that are watching
Mhm.
that we have these conversations about burnout, not necessarily saying we are burnt out from being a community health worker, because I'm not. I love being a community health worker. And like Tammie, I formed a nonprofit in honor of my mother. I had no background in public health, community health, or anything. Tammy went to school. I wanted to be a writer. English degree. That's all I wanted to do, was go to college, get an English degree, and write. So I had no knowledge of healthcare. But when I formed my organization, or this organization, I don't say it's mine because it belongs to the community. Um, I became a community health worker almost like by default. I wanted to increase awareness, share my mother's story in hopes of lessening the burden of diabetes. So I will always be connected, or be a community health worker. But I want to focus more on my writing. So you can merge them. And Tammy is a fantastic photographer, and you incorporate some of your creativity in the events that you have in the community. So, and that's why we wanted to kind of have the conversation about pivoting. And because when we look at health, there are different dimensions of our health. Physical health, mental health, that's just one of them. Also career, what you do in your social life, that's also important, and your career. Because if you hate your job, or you
Mhm.
don't have any friends, or you're not able to socialize, that affects your health. I think so. That's another reason why I wanted to kind of touch on that topic. So thank you for sharing that, Tam.
Well, you're welcome. And I also want to say this, people will put their all in the job and be there almost 30 years. And then when they finally retire, never taking care of themselves, never taking advantage of that PTO and vacations and all that.
Yeah.
And there's nothing worse than retiring, and then your health is at
Right.
risk.
No, you're right, and you're right, and also right. You're right. I didn't mean to cut you off. So go ahead. I'm sorry.
No, that's it.
So there is, and we have a program, the Ruby A. Neeson Diabetes Awareness Foundation, because we work a lot with seniors. So I facilitate a class with seniors on healthy aging and goal setting. And I always share this story. It's a story of Miss Mary Walker. Go look it up. She is a woman that learned to read. I think she was 116 years young, 116. So she learned how to read. So it's so important that we know that you're never too, I mean, age, like they said, age is just a number. You're never too old to learn anything new, or to maybe start a business, or to cultivate a hobby or something like that. But you have to, in order to do that, I think about that lady, Miss Mary, she had to take care of herself. So if you take care of your body, and you're right, Tammy, we only have this one body. Even the people that believe you can be reincarnated, we only have the one body while we're in this life's arena. So let's take care of it. So you can, if you want to set a goal later in life, you absolutely can. Age should not stop you.
No, it doesn't. And when I was at the Peachtree Village International Film Festival that this past October, and I met this gentleman. I think he was like 87 years old,
Wow.
and he had wrote a book, and he
Yes.
was writing a script for something else. He drove 2 hours. I don't know where I can't remember where he was, but it took him 2 hours to get to Atlanta.
Mm.
He could come to Peachtree Village International Film Festival. And I overheard him talking to somebody, and whoever he was talking to, they had got up and left because I was sitting eating breakfast, and I invited him to my table because I wanted to hear more about his script that he was writing.
Yeah.
And yeah, and he was in his 80s.
In his 80s. And he wrote a book.
Yeah.
Yeah. He wrote a book about AI, right? I love
Yes,
that.
he did.
Okay.
It was AI. He was working on something else, and he, like I said, not 80 something, some years old. He was driving still, not just driving, but drove 2 hours. Okay.
Wow.
And so, and he was very nice. And I said to him, let me take you, if you mind, can I do a mini photo shoot for you for your new book or whatever that's going to be coming out? So we went outside the patio where we were, and I took some pictures of him and his book, because that inspired me so much, because a lot of times people like to put this stigma on us and say you can't do this now because of your age or this age. And that gentleman, he let me know right there. It was just reinforcement, validation that that's not always
That's
true.
right. That's right. That's right. I'm going to put the name of his book in the description. And yes, that was such a touching story. So if you're watching this, yes, you're never too old to, start something new or learn something new. So thank you.
Always be learning.
Right, always be
Always
learning. Yes, and Tammy, she makes sure our seniors, they are, she talks to them about technology, getting on TikTok, all of that stuff. So I appreciate your contributions to the community. And you guys will hear a little bit more from Tammy in the future, because I'm going to invite her back. We have these conversations all the time, so I'm happy we could present it to you in a way that you will know a little bit more about the work as a community health worker, its value, and also the importance of aging healthy. So any more tips, Tammy, you would like to offer before we leave?
Yeah, on the heels of what you just mentioned, we're all going to age. We can't avoid aging.
Yeah.
But are we all going to age well? Okay. So that's the key thing to remember in that phrase is aging well. We just always have to be conscious of what we're putting in our body, what we're not putting in our body, and should. Just specifically, everybody, watch your sugar content, watch your salt. Those two things right there, sugar and salt, Those are the main culprits that ages you and deteriorate your health. So I'll just say that.
Well, thank you so much, Tammie Peterson. So, if someone wants to connect with you, how can they reach you? Besides the Ruby A. Neeson Diabetes Awareness Foundation, she is one of our board members. She's not going anywhere. I'm not going to allow her to leave.
How can they reach
Yes,
me?
as a
So
photographer,
like not
as
me?
a they may have some tips like
Oh,
how what kind of night cream you use. You got such nice skin. How can we how can you help us age healthy? So how can they reach you?
how can they reach me? Well, I mean, I guess my social media page. I'm Camera Girl 1214 on Instagram.
Okay. Well, thank you so much, Tammie, for
You're welcome.
kicking off this series, Many Faces, One Vision. We all have, a vision for the world to be a much better place, to be a healthier place. So thank you so much for having this conversation with me. I greatly
Thank you
appreciate
for
it.
having me.
Okay. Well, we'll see you guys next time. Thank you. Bye bye.
Bye.